you ever heard of bed sores before or pressure ulcers before? Well, this condition is another serious one that you need to take very, very, very serious. Okay, well, this condition, it's a very serious one and needs a serious and then an immediate medical attention. Now, without wasting much time, let's get into the video. What is bed sores in the first place, or pressure ulcers? Well, bed sores are localized damages to the skin, okay, and underlying tissue, typically occurring over bony prominences due to prolonged pressure, shear, or friction. Okay, so now let's move into the possible causes or the common causes. The common causes are as follows. I'm going to give you 8 common causes. The first one has to do with immobility. Okay, then where that is when you sit at one place for long and then you are not moving. The second one has to do with pressure. That is prolonged sitting or lying. The third one has to do with shear. That is sliding down. And then the fourth one has to do with friction. That is dragging skin across surfaces. The fifth one has to do with poor circulation. That has to do with your circulatory system. When it's actually in danger, you can also be a victim, or it can also cause this condition. And then the next one has to do with malnutrition. That is the sixth cause. That means you need to take your diet very serious, okay? And then the seventh one has to do with dehydration. Drink the required amount of water. Don't deprive yourself of drinking enough water. It's good for your health. And then the eighth one, or the final one, has to do with neurological conditions. That is paralysis, sensory losses can also cause this condition. Okay, so what are some of the common risk factors? Well, there are some risk factors available, and then they are as follows. The first one has to do with aging, that is old age, 65 years plus. You are at a higher risk of having this condition also. Obesity is another risk factor, sorry. And then diabetes is also another risk factor. Heart diseases, another risk factor. Respiratory disease, another risk factor. Limited mobility, another risk factor. Poor nutrition, take your diet serious, I tell you again, another risk factor. And then incontinence is also another risk factor. Now, someone may be waiting. What are some of the signs and then symptoms to look out for in this condition? So you take the necessary step. The earlier, the better. Well, I have some amazing signs and symptoms for you guys. So let's move into the video. So the first one has to do with redness at a site in which you are suspecting. The second one has to do with swelling. The third one has to do with pus or discharge. Okay. The next one has to do with vomit. Okay. That is when the site in which or the injury is, the wound or the sore is actually located. The area around that sore becomes kind of warm. Yes, temperature increases. And then pain sets in, obviously. Then open sores. Okay. These are signs and symptoms to look out for. Now, let's move into the stages. The condition has stages. And then they are as follows. We have 4 stages for this condition. Stage 1, that is non-blanchable erythema. Then the second one, or stage 2, is partial thickness skin loss. Okay. And then the stage 3 has to do with full thickness skin loss. That is stage 3. And then stage 4 has to do with muscle, bone, or tendon exposure. That means it's moving in deeper. That is stage 4. Now, we are moving to the role of physiotherapy. As I said, I am a student physiotherapist, and if I don't say anything about physiotherapy, I don't think the video is going to end. So I need to do justice to that. You get it? So yes, so I have some roles of physiotherapy in handling pressure ulcers or bed sores. And I'm going to just give you 5 of the rules of physiotherapy, and then they are as follows. Let's make it snappy. The very first thing we physios are going to look at is positioning and then repositioning. Okay, that means we are going to be educating our patients on adapting to proper positioning, okay, to prevent bed sores. And then the second one has to do with pressure redistribution, talking about the mattresses and then the cushions. The third thing has to do with mobility and then exercise programs, which is very important. And then the fourth one has to do with wound care. Finally, we have wound care protocols. Thanks for watching. See you next time in the next video. Bye.